Everybody, thank you for the work you do. Let's fill up YouTube with all kind of helping videos to help people thrive and heal. I want to talk about an issue that is really important for us to be careful about in counseling and psychotherapy. It's sexual attraction between counselor and client. Know that it's normal and it's common, but it's also one of the leading ethical complaints that we have. And it's so important for us to recognize just how normal it is, because this is, in ways, an intimate relationship. I mean, we're making eye contact, we're listening to folks, we care for them. And when people are in pain, and I'm speaking of clients, it's common to want to seek ways to feel better, whether it's alcohol or drugs or unhealthy relationships. So this happens, and it also happens for a counselor to feel attracted to the client, okay? Now, counselors, I do not recommend that you disclose that to a client, okay? That's for you to process with your own personal counselor and with your supervisor. It's normal to feel it, but I don't see that it's appropriate to bring that up to the client, okay? You also need to be careful about accusations, false accusations. So this means paying attention to your work environment, having an office that's got glass where you can be seen, there's people around. It's fine for it to be smoked glass or to have some type of curtain covering, but just so that it can be clear that counseling is happening in this office and nothing else. But it's also important for you to know, if you're a student of counseling or a professional, who is around in the building. Who would I go to just to in case I need somebody to back me up and so forth. So another part of this for accusation is making sure that you're getting supervision, regular supervision, so that you can process these very normal feelings. Also, when you go to training, make sure that you're documenting that you are seeking out training on ethics and how to maintain your ethical boundaries. So these are just some ways in terms of, if you were falsely accused, which would be rare, that you would have documentation that you're doing everything possible to maintain ethical boundaries. Now, you can change up what I'm about to say to fit, but I do know that this can be a charged situation for a counselor if a client is either implicitly or explicitly expressing the desire for romance. So I did want to give some fairly concrete statement, which should be stated firmly but not harshly, okay? Because you want to make it clear. So here's what I would say would be, your client has expressed romantic desires toward me, the counselor. Your feelings are normal and common within the realm of psychotherapy. And while I can appreciate the courage it took to disclose this, ours is a professional helping relationship, and there will never be a romantic relationship between us. In terms of counseling, we have options. I can refer you to another qualified colleague, or we can discuss your feelings in the larger context of your past relationships and future ideals of what you'd like in a healthy partnership. So the disclosing of a desire for romance can be a rich area for processing, but you need to make it clear at the get-go that there's not going to be a romantic relationship, that we can process your thoughts and feelings in terms of where you may have learned this, how it's worked for you or not, and what you want in an ideal partnership. Okay, so I'm hoping this is helpful. I think there's going to probably be some more spin-offs on this video. Let me know in your comments. Thank you again for all the good work you're doing, and we will talk to you on the next video. Take care.